To begin your admission med rec, you will select the reconciliation tab, and the next screen you see has three options on it for admission, transfer, and discharge. At this time, we are not using the transfer option, and the first thing we're going to do is an admission med rec. To select this, you touch Start, and the med rec will load. The information you're seeing is the information that has been collected by the nurse and is built with a list of home meds from her interview with the nurse. These are listed at the top on the first screen that comes up. Other meds you'll see at the bottom are the meds that have been ordered on an inpatient basis for the patient already. If the patient's a brand new admission, there will be nothing at the bottom. If it's been a few hours since the patient was admitted, you may have more medications that are listed as active inpatient meds. Okay, and you'll notice these are also defaulted to continue at the bottom. Okay, your med list can be sorted in three ways. We have the initial sort is home versus hospital. You can also touch alpha at the top and it'll list it alphabetically with scheduled and PRNs at the bottom. You can list it by drug class, and the drug classes are listed here with the drugs that fit into those classes with those. You'll default to the home and hospital sort, and that's probably one of the best sorts to use with this initial screen. You'll notice the icons are listed here on the side, left side. The little house icon indicates this is a home med. You see that's not present for the hospital meds. And you'll see an equal sign, which means these are duplicated. If there are more than one listing here, it'll be equals. In this case, the hospital med has been ordered this equivalent to the home med. If you hover over the name of the medication, it gives you more information about the medication. You see you have start date, when it was initial prescription and was written for that, if the patient's given that to the nurse. Last dose taken, yesterday at 12. The indications listed. You also have some special instructions and clinical comments if the nurse has filled those in. Those won't be present on all meds. It's only what information the nurse may have put in. With the Zithromax, you see there's no information included. Nothing was filled in by the nurse. So by hovering over that medication, you can see the extra information. You'll notice that at the bottom of your screen, you have some buttons here. That the one button for home meds. If you don't want to reorder any home meds, say the patient is condition doesn't warrant continuing the home meds right now, you can hit don't enter or don't order, excuse me, and it will fill in the don't blank on all the home medications. So this is really the only full scale selection you can use. Okay, we can go over the individual medications. Let's look at the little tabs to the right here. You have four options. You have a tab to order, a tab to modify the order. Don't means to stop the home medication, not continue it in the hospital, and a clarify, which sends a message to the nursing staff on their work queue to make a clarification. You can put a free form message to the nursing staff to get the information. We'll show you that in a little later. Also at the bottom, you have the same basic buttons: continue, modify, DC for the inpatient med that's already been ordered, or clarify. So those are all available for those medications as well. Let's look at individual medications. First of all, again on the right here you have a working list, and on the left is the initial list. The working list is already pre-populated with the hospital meds, as you can see. Okay, let's go ahead and look at the pravastatin, and we'll decide to go ahead and order that pravastatin. This is the screen you'll most often see on medications when they come up. Most often you will have to enter one item such as the dose, and this is the order entry screen, very similar to what you see in Orders Express. At the top of this window, you'll see the nurse's version of the order. In this case, pravastatin 80 milligrams oral at bedtime. Below that will be the working version of the order that you're working on yourself at that time. And these two need to match up. You need to be very careful and note that these are identical or close, or what you actually want is the working version. If there's an item missing, a prompt missing here, it will be in brackets. In this case, the dose is missing, so you need to fill the dose in here. You touch the drop down. In this case, it's 80 milligrams, which is not present, so we can actually free form 80 into that field. Check the other elements of the order, and they're all correct. And we will go ahead and hit save, and this order will be done. It will travel over to the working list and be ready to accept when we're finished. You'll also note here it says modify, because we did have to add the dose to it, so that considers it a modification of the medication. Okay, let's go with the amlodipine. And you notice we have an equal sign, and if we look and see, the amlodipine has been ordered on the patient when they were initially admitted. In this case, we have a couple of choices. We can stop this and let this one continue in the hospital, or we can stop the hospital med and maybe make an adjustment to this if we don't want the increased dosage. So let's go ahead and DC this one. And so that'll DC the hospital med. It's been removed from our working list, and we'll continue this one, possibly modify it. We'll go ahead and order it. And you can't modify it. You don't have to choose the modify selection. Now, one of the things that does happen with these medications when you order them, if all the elements that we saw, the dosage, the route, the frequency, all matches up with things that are built in our hospital computer system, it will flow immediately to the working list. It does not stop at the screen for you to review the order. In this case, we have the 5 milligram oral daily, and it also has a notation to take a half a tab if the patient's lightheaded. So we really don't want that to go through to the hospital ordering, and the nurse will wonder which dose to give. And we may want to change this to maybe BID. So you can go back over here if it goes completely to the working list and touch on this and click on the medication, and it'll open the window again that has the dose and all the information that we usually see. In this case, how often we'll change it to BID, and we'll take out this information about lightheadedness because it doesn't really impact the hospital stay. So we'll save this. You'll notice it comes up here with a changed order. It's BID, and the information is gone over here. Now this does remain intact for discharge, so all the home meds will remain intact no matter what changes you make, so that they can be ordered again on discharge just as the patient came into the hospital on them. Let's look at the albuterol real quickly, and we'll order the albuterol inhaler. Now you see you'll have some choices here on occasion. You may have a liquid or a suppository. In this case, we have a nebulizer solution and an inhaler. If we aren't watching closely and we pick the nebulizer solution, hopefully that's what we did, and hit next, and you'll notice it doesn't quite match up. We need a dose put in here, which is 2 puffs, but they're going to ask you for mLs here. They ask you for a value in mLs, which shows that there's probably something wrong with your selection. So we can go back to the previous screen, and we did pick the nebulizer rather than the inhaler. Hit next again to go to our next screen. And again, all the elements were filled in on the albuterol. I'll click on it here, and I'll show you that all were filled in perfectly, including the indication for asthma. So it went over and traveled over the working list without stopping at this screen. So we'll stay the way it is. Okay, let's look at the metformin, and we'll order that. And you notice this is one of the things you'll need to watch. The sustained release products, liquids, again, suppositories, XRs, SRs, you'll have to watch and make sure you're selecting the correct one. In this case, it's the regular glucophage. And our order comes across the nursing variety as 500 milligrams 2 times a day. And so we need to add the strength. But if you'll look back here, there was a comment on this that does not come across. Some comments do not come to this screen. If a nurse has put it, we've instructed our nursing staff not to use this comment area, but if it's used by mistake, it will come across here. So it's important that you observe what's over here as well. So in this case, they're actually taking 2 tablets per dose, 1,000 milligrams. So I would suggest you go ahead and put the 1,000 milligrams in this field for the dose. And there may be a reason they're taking 500. Say they can't swallow 1,000 milligram tablets. So in this instance, I would instruct the pharmacy to give 2 500 milligram tabs per dose, and pharmacy will enter it that way, 2 500 milligram tabs for you, okay? But this message did not come across unless you had noticed it on the other screen. Okay, let's go ahead and look at the Protonix. In this case, Protonix is here, and we have an equal sign, so they're on an IV Protonix, and we'll not continue that. We'll continue our IV Protonix, so we don't continue that particular order. Percocet's listed. I wanted you to see what a combination product would look like. In this case, you'll see there's Percocet liquid to choose from. We're going to take the tablets and touch next. And there's a warning here. We have a morphine allergy, I believe, on this patient. And it will say here that it could be an interaction, but they've been on at home, and we'll just continue that because they've tolerated it before. Touch next. And you'll see the dose is 1 to 2. Your actual medication strength is up here, and the dose is listed down here. So this matches up perfectly. You need an indication because the arthritis was in the comments. It's not actually an indication field. So we may go ahead and look at do a pain for moderate pain in this rather than the arthritis, and just keep everything else the way it is and save that. We will look at Xanax. In this provides another example of an error that can occur. In this case, Xanax went through and went straight through to the window to put in dose and so forth. But if you look at the version that the nurse put in, it's Xanax XR at bedtime. It matched up in the computer system with plain Xanax, which is a different product, but it is the same active ingredient. So you need to be careful and keep an eye on that. In this case, you need the dose and the indication. So we could have two options here. We can back out and stop that Xanax XR because you know the pharmacy doesn't have it and put it in as a non-formulary, and pharmacy would have to get some for you or give you a call about it and see if you wanted to change. Or we can change it at this point to the regular Xanax. So let's go ahead and change it to the regular Xanax, which came up. We'll lower the dosage on it, and we'll leave it at bedtime for sleep. Again, the sleep is in the comments. We'll need to put it in the indication field for sleep. And we'll save this, and it will go ahead across. Now, again, on discharge, the Xanax XR will come up for you to continue if you choose to continue that on discharge, or you can stop it and leave them on the regular release Xanax if that's what's working for the patient at the time. Okay, let's look at the Zithromax. We're looking at this order and we see Zithromax doesn't have a whole lot of information. We'll hover over it here. It doesn't tell us what the dose is or when it was even started, to tell you the truth. And so you don't recall possibly prescribing this. Possibly the patient went to a quick care. It could have been any time in the last month or 2 months and went there. So likely this does not continue, but you want the nurse to clarify it. So we hit clarify, and there's a free form window comes up, and you can put in here check to see if patient is still taking med and you need the dose. And if you accept this, save this, it goes to the nurse's work queue for her to verify that with the pharmacy or with the patient and get back to you on it so that an order can be written. Let's look at the promethazine with codeine liquid. We'll order that, show you what a liquid looks like. Again, we have an interaction with the morphine, and this is a home med, so they've tolerated before. We'll touch next. And this is another thing that may come up. You have a 1 teaspoon 4 times a day is needed. In this case, you need the dose, and the dose is in ml, so you would need to convert the 1 teaspoon to 5 ml dosing, and it has everything in here that you need, except the indication again is missing, and for cough needs to be moved up to the indication. We'll save that, and our order for the Finnegan with codeine is ready to go. Combination products are a little bit of a challenge with the Admission Med Rec. We'll try to order the Zest Diuretic, which is a combination of the Prenadil and hydrochlorothiazide. When a combination is selected and put in by the nurse, when you select it, it brings up the first ingredient only. In this case, it brought up lisinopril and need a dose, oral daily. It did not bring up both ingredients. So we'll have to check the lisinopril dosage of 20 milligrams. Daily is correct, and we can see that all of our other parameters are correct. And you can change these parameters. If you think you need a stat dose on something, you can change this to stat or next scheduled. Very simple, similar to what in Orders Express. I mean, change frequency or anything else here. So let's go ahead and save this one. So we have half of that order done. Now you notice it doesn't ask us or indicate the hydrochlorothiazide needs to put in there. This is kind of a deficiency of this system, so you'll have to add that. At the bottom, we do have an Add New Med field. You can add it at this time, or you can wait till you finish your session here and add it in Orders Express. I think you'd probably be wise to add it here since it's on available here. The dose and everything's available here for you. So you can put in hydrochlorothiazide. Gives you some choices here. We'll select this one and touch Next. And brings up a screen you're familiar with. In this case, we needed, as you can see here, 12.5 milligrams daily. And we'll go ahead and change that to 12.5 daily and so forth. And it will save it. Again, when you are on discharge, this order will be available to continue at home. You don't have to continue the 2 ingredients at home. Okay, let's look at the item here at the bottom, the Dalaresp, and order that. Okay, you came up with no selections here. So this indicates that this medication is not recognized by the system. It's either misspelled grossly, or it is a free-formed, or it is a non-formulary med. In this case, it is a non-formulary med. So we would need to cancel out of this and add it as a non-formulary. To add as a non-formulary, very similar to what you do in Orders Express, type in NON, gives you a non-formulary template, select that and hit Next. And again, it's a blank form here for you to type in. Just Dalaresp, 500 micrograms, and the route is going to be oral. How often is going to be daily, and you can put in a comment at the bottom if you want. Such as use own med, if you choose. And so you put it in on formulary and you save this, and you'll come over to your working list. It looks a little different. It just says non-formulary. If you hover over it, it will give you the Dalaresp and the dose and everything, the information if you hover over it. Okay. Everything in this group of medications needs to be addressed. All these need to be filled in with something. So we have to stop the Dalaresp because we actually entered as a non-formulary. To complete this, everything has to be filled in. And it will come back again on discharge for you to choose it if you want to continue it at home. Last thing left is the flaxseed extract. Now you notice flaxseed extract looks a little different. The printing looks a little different than the other meds. This means that the nurse has free-formed this item. So it will not match anything in our formulary to select. If they had put in the amlodipine as a free form, it would be in this type of a italics lettering as well, and it wouldn't match up with amlodipine, even though it is in our formulary. So anything free-formed in this italics won't match up. And in this case, it's probably not going to be available in the pharmacy, and they don't have their own with them. You don't really think it's necessary, so we'll say don't for the flaxseed extract. Okay, so all of our items are addressed on the page. You can look at the inpatient meds, and if there's something there that needs to be discontinued, you're welcome to do that at this time, or you can make a modification. So let's say that the Dilaudid dose is a little high. They've been pretty drowsy. We can touch modify on the Dilaudid. Okay. Oh, okay. You can touch over here, touch it over at the right side, pull up the Dilaudid on the right side. Well, it should allow for modification. It's not working quite right. It should allow modification here. And in most cases, you could bring it up and change the dose to 0.5 milligram in a screen that was similar to the other screens here. Let's see if we can do this one as well. No, for some reason, those are not working right, but they will work in the live system that you can modify those. Okay, so we've completed everything in our list here, and to complete your MedRec, you would touch the bottom here. Again, you could add new meds here if you want to add some antibiotics or something to the patient. You could do that. Or you can complete MedRec, and it will complete this and send it across. This will go to pharmacy, and it'll be processed based on the information you gave them. This is a final review of the medications and the warnings that you have overridden as well. Just kind of a final summary review. If you touch OK, it will take you through and accept those med orders and send them through for you. Takes a few seconds to do this. The next thing we will discuss is a discharge. I'll go to a different patient here and we'll look at a discharge MedRec. Pick a different patient. And this patient already has had an admission MedRec, as we'll see. We'll touch reconcile medications here. And you see you have admission, transfer, and discharge. The admission MedRec was done earlier this morning. And we'll go ahead and touch start on the discharge. And your list looks very similar to what you saw on admission. You have the home meds as they came in. This patient's on a very similar group of meds, not quite exactly the same, but very similar. And you'll notice you have some more duplicates because the medication has been continued during the hospital stay. So you'll have a lot more equal signs here. And so they're sorted very similar way. And you can change the sort just like you could on the other format. Hover over these and it'll give you information as well on the medication, more detailed information. You know, notice a couple more windows or a couple more selections at the bottom. These give you a chance to continue all home meds if you choose. Okay, so by touching this, all these will populate the continue box here and move over to your working list. Or you can not resume any home meds. Say you don't want to continue, you want more of what the patient was on in the hospital continued than the home meds. And it would hit stop, would fill in if you did that one. All hospital meds, you can say don't continue all hospital meds, which may be happening in some cases. Maybe there are a lot of things that you don't want to continue exactly the way they were in the hospital. So these are three group processes that you can do to cut down on your time. What we recommend in general, because it produces a much nicer medication sheet for the patient to take home, is to continue as many home meds as possible if the orders are going to match up to what you want, rather than continuing the hospital version. So if these two are equal, amlodipine is equal to the two places, then you would continue the home med rather than the hospital and stop the hospital med. So to continue is very similar to the admission. You touch continue on the albuterol here and it will flow over. And it's going to say QID, PRN. If you think that that's you want to start that routinely, say at home, you can always modify it if you want. You can touch it here and modify that to make it a routine order by taking the PRN out. So it'd be a 4 times a day routine now. So you can always make a change in that. It comes back and says modify on this. So we want to continue the Xanax XR because the patient was tolerating it well at home. In this case, you want this patient was on amlodipine 10. It went from 5 to 10. You want to continue that. So we'll stop the home med and continue the hospital med for amlodipine. We'll take care of that one right there as it goes. Zithromax, you found out that was an old script and it was not necessary to continue it. Flaxseed, the patient enjoys taking it, so we'll continue that. We have 2 Norco, and we have Percocet. So you want to continue the Norco, and notice the allergy is going to come up for you to review the allergy. And we'll stop the Percocet. Okay. And we have the combination. Again, I told you the combination would come up. We'll continue that. The metformin, simply the way it was when they came in, is fine. The Leveza, that's something that's an old medication. It should not be on here. We'll stop it as well. The non-formulary comes up in its original form, and they're also on Flomax. This particular patient was. We'll continue that. So we've addressed all the home meds from a previous admission, and we'll go ahead and let's go ahead and see if we can stop. We'll stop everything else down here because we've already ordered it up here. We'll stop the version that was in the hospital. Again, here's your hydrochlorothiazide and lisinopril. We don't want the Dilaudid injection at home. And the metformin has been ordered. Non-formulary has been ordered at the top. Ondansetron's IV. We don't want that. Percocet's been ordered at the top. Protonix is IV. And the IV sodium chloride, of course, will stop at home. Now, we could have selected here all hospital meds don't continue, and this would have all populated stop. And we could have come back and taken one away by hitting continue on this. After all the stops have been filled in, you can still hit continue. I'll show you this similar to this. Okay, so these can be manipulated as you go along. Now you have your final working list here with the meds that you've continued. Most of them are actually home meds that were continued except the amlodipine. And you can actually add meds here if you want to add something to go home. To complete the med rec, you would complete it here by hitting complete. It's going to give you the overrides that you did. Touch that as OK. And the med rec will be finished. And it will print, the nurse will be able to print out a home instruction sheet for the patient. So that's how you do med rec.